the meeting, and I appreciate that you reminded me to record the meeting because I probably would have, that would have slipped my mind, no doubt. Thank you. So how about we take a few minutes and allow everyone to introduce themselves. Was it, I'll apologize, was it Robert?
Yeah, this is Robert Madison. I'm the physician champion for Palau NCD Collaborative. Okay. And then here with me I have two of the CDEMS folks involved, so I'm going to have them introduce themselves and what they normally do.
My name is Eunice, and I'm with the NCD data for CDEMS.
Thanks for your time. And
go ahead.
Thank you. Hi, my name is Suzette. I'm the overall NCD data manager. I work with the Breast and Cervical Cancer Program as well as the NCD diabetes program and the cancer registry.
Oh, that's great. Okay.
Yeah, there's only three of us here, so.
Okay, I'll pause, and I think there's some other folks on the call too, so whoever would like to introduce themselves, please do.
Hi, good evening to Adam and Mary. This is Edlin from Ministry of Health, Marshall Islands. Good to see you, Adam, again.
It's good to see you, or good to talk with you too.
I'm here with the Majuro team. I'm with Yisa, John, and Kathy Otuafi. There are NCD nurses. There are the ones seeing the patient and entering the data in CDEMS. Okay. We also have our NCD clinical director, Dr. Lucy. She's also here in the room. Dr. Lucy. Hi. She said hi. I don't know if you guys hear it. And Ibay will, I think Ibay is joining soon, hopefully before we start. And looking forward to this learning session.
Oh,
thank you.
Well, thank you all. Are there other folks on the call? No? Well, Cecil, how about you bring yourself over? I've got Cecil Pollard and Mary Swim here with me, so I'm going to move out of the way and allow them to introduce themselves.
Hi, I'm Cecil Pollard. I'm Director of Health Services Research, and I've met some of you on my trips to Guam, and we met in Hawaii a few years ago, but we're glad to be back doing these sessions with you. Thank you.
And hi, I'm Mary Swim. I'm the computer programmer, so hopefully if we have any technical problems with the programs that I can help Adam fix them. Thanks.
And I'm Adam Baus, so it's nice to talk with some of you for the first time, and good to talk with some of you again. So it's been a while. Edlin, great to hear you again, and great to hear everybody. So we have some materials here that may be more pertinent for others that have little to no familiarity with CDEMS, but we have a nice small group.
But you don't hear us.
Hello?
Sorry, that's Ibay.
That's okay.
Yeah, but we are seeing like a learning section on you here. But you cannot hear me. We can hear you.
We can hear you.
Can you hear us? Anybody?
Yes, now we can hear you.
Oh, yeah. We can hear you.
Jenti, Colorado 258.
Hello, from a team from EY. Hello.
Hello.
Here with me, our Assistant Secretary, Ms. Gloria Chiari, our Medical Director, Chochotin, Cora, and myself, Johannes.
Okay. Thanks for your time. Yeah, good to have you. Thank you. So everyone that's on the line, have you had the opportunity to say hello?
Hello?
Okay. So the materials that we have to share today may be something that you're already familiar with, or it may be something that's newer to you, depending on your familiarity with the registry. But we'd like to keep this very informal and conversational, and as much as we can have a nice talk between all of us during the session, we really like to encourage that. And so as you have questions, please feel free to interrupt, and we want to make sure that everybody has opportunity to share their thoughts and questions along the way. So does that sound like a good plan?
Yes.
Yes.
Okay. Okay. So we wanted to acknowledge the Pacific Chronic Disease Council and leadership and partnerships in getting this collaborative moving. So I've been working with Cecil and Mary in the Office of Health Services for about 14 years now, and it's these kinds of collaborations and that really excite me the most. I think that allowing partners to communicate and to share their experiences in what's working and what's not working is really essential. And the PCDC, and with leadership from Gwen Hosey, who you likely all know very well, is very instrumental in making that happen. So I did want to say thank you. And we're getting a lot of background noise from someone. I don't know if it's possible to hit mute for a time until things quiet down a little bit, but I did want to point that out. And there it is. Okay, so just a little bit about our office. There's a, I don't know if you got to mute their computer for a moment.
Oh. Can you see well? So can we close? Sit close here. What is this?
Could everybody could everyone try muting their mic?
Could you please mute your mic? Thank you, because we can hear you guys. Come on.
We'll just pause for a moment while folks mute their mics. It's okay.
Edna, can you repeat the phrase you were saying?
Oh, we were asking if everybody could mute their microphones a little bit, at least while they're not talking, so that we didn't pick up so much background noise. It was kind of hard for everybody to hear.
I think over the web it gets magnified, so it's worse than it is in person.
All right, that sounds pretty good. Okay. So just a little bit of background information on our office. So I've been with Office of Health Services Research, like I said, for about 14 years. And Cecil Pollard's been director of our office for over 30 years. And Mary's been with our group for around 20 years. Yeah, so we're a small group, but definitely dedicated to helping improve the delivery of healthcare and ultimately health outcomes among patient populations that really need extra care. Much of the work that we do is data-oriented. So whether it's helping partners set up and manage and get the most out of a patient registry, like CDEMS or like PECS or any other registry that might be out there, or whether somebody already has an electronic health record and is trying to use that. Regardless of where the data are coming from, we want to make sure that our partners are as comfortable and as equipped as they can be to put those data to good use for patient care. And we're still getting a lot of background noise from somebody. I don't know if we're able to figure out who that is, but it would be pretty helpful if we could mute. Yeah, I'll try and bring over.
Corab,
Yeah.
please mute your microphone. We can hear you, please. Just mute
Mute the
it so that
microphone.
Adam can.
Okay.
Thank you. That's great. Fantastic. Okay.
Yeah, if you have to ask a question
Yeah.
or anything, feel free to unmute.
Yeah,
it.
please
Just
please
a lot of
unmute
feedback.
yourself whenever it comes time to ask a question or to chime in. But if you could keep yourself on mute in between, that'd be really helpful. And we'll do the same thing here. So if we pass the screen sharing over to somebody else, we'll mute ourselves too, so that we don't get background noise from our end. So like we were saying, regardless of where the data are coming from, whether it's a patient registry or an electronic health record, we really try our best to help our partners move along that continuum of becoming increasingly competent and comfortable and knowledgeable about what those data are and how to put them to good use. So quality improvement and informatics are really where we're coming from in terms of what we can help bring to the table. But it's very good to be working with you all. Let's see. So here's, I'll keep my eye on the time. We have about 40 minutes roughly for to work through our outline together. So here's what we were thinking of covering with you. And if you have feedback on this outline or if you'd like to see something additional to this, let us know, and we'll be glad to do it today. And we can also have follow-up sessions with you outside of this session so that if we didn't have opportunity to cover anything today that you do want to see, we'll be glad to do that with you individually or during the next session, the next group session. But we were going to look at the basic computer requirements for running CDEMS. Two different methods for data entry, make a look at data editing and how to make patients active and inactive. There's a lot of modifications that can be done in the registry, so we look at the utility tab with you to make sure that you're aware of those and have some familiarity with how to make those modifications and how those could benefit your clinics. And we can take a look at how to run existing reports and create new ones that don't already exist, and take a look at some of the population health and patient reminder features in the registry, such as reminder letters and call lists. So this particular session is about some of the basic registry functions, and it sounds like many of you on the call have some familiarity with CDEMS already, so we won't need to dwell on how to do data entry. But if there are questions that you have about that, please let us know. If there's any issues that are coming up when you're maintaining your registry, we'd like to know about those too. So part of our office's role with you all is to help make sure that you have the best shot possible in making CDEMS something that could work for you. So the more we know about the barriers that you might be having, the better. And just for a few seconds, I think it's worth talking briefly about what we mean by a patient registry. There's various definitions out there, from Agency for Healthcare Research and Quality to other organizations and researchers, and some of those definitions are pretty wordy. I won't read this one to you. It's on the screen there. You can read it for yourself. But in a more practical sense, wait, there was a question there. I want to make sure I see it. Oops. Let's see. Where'd that question go? Okay, extracting data. That was from, it's Chuk. Okay, we can certainly talk about how to extract data. Absolutely. One of the major strengths of CDEMS is that your data are not, being sort of like held for ransom. You can get to all of the data that are contained in the registry. You can do that in a de-identified format if you want to share data with partners, or you can even do that in an identifiable format too if you're sharing data internally. But we can take a look at how to create a de-identified data set, and we'll do that tonight on our call. But in a practical sense, a registry is a very careful way of collecting standardized information on specific patient populations for a specific purpose. And in other words, so the diabetes registries that you all have, that you chose diabetes for a reason, right? It's an important health disparity, important priority health condition among your areas. And you have specific things you'd like to be able to track on all of those people with diabetes. So a registry is an opportunity to hone in on very specific things and to come up with good information that helps inform those patient populations so that you can do something additional to help them. So the diabetes information that you're collecting across your various areas will be very essential to better understanding the burden of diabetes and what can be done collectively to really help address that. So for us, a registry is a way of putting data to good use for patient care, for follow-up, targeting, monitoring, and ultimately prevention. And the prevention is what really excites me too. So computer requirements for running CDEMS. And if any of you have questions, folks from Chuk are already using the chat features in GoToMeeting. Please feel free to continue to do that, or unmute yourself and go ahead and ask them. But CDEMS runs on Microsoft Access, which is a part of the Microsoft Office suite, sometimes, not always. Depending on which Microsoft Office package you have, it may or may not come with Access. But the system requirements for running CDEMS are very, very minimal. It will run on Access 2000, 2007, 2010, 2013, 2016. So it does not take really anything special, not a lot of computer requirements or horsepower, so to speak, to run CDEMS.
And it's usually in the Office Professional package rather than the standard Office package for some silly reason.
Office Professional. All right, thanks, Mary. Mm-hmm. So CDEMS is a relational database, which, only means that the registry, when you boil it down, is a series of tables, right? So those tables hold data, and they're tied together, and data are displayed in different formats as you call them up. So CDEMS has a database that's ideally stored on a server or somewhere safe if you have one, somewhere where that registry can be backed up regularly, ideally automatically, so that no data would be lost over time. So you've got a back-end database with different apps that are connected to that data file. So you have one piece of software where you can do data entry, editing, printing, previewing, data management. Then you have another piece that's the reporting component, where you can run reports by patient, reports by provider or patient groups, reminder letters, call lists, that sort of thing. And then we have other apps too that may or may not be relevant to your needs, but we've built apps for laboratory companies so that our partners didn't have to hand enter their lab values into CDEMS any longer. They could import them in. We've built apps that import data from electronic health records into the registry to, again, save on registry maintenance. So it's a modular system, basically, where we can build additional tools, features over time, and link them to that same data file that you have. So the benefit of that is that we don't disrupt the data you're already collecting, while at the same time we can continue to build features in. And yes, it will work for 32-bit and 64-bit. Juru, good question. Mary just recently made some fairly substantial work in CDEMS with work that we were doing with the Pan American Health Organization. It was Dr. Barcelo, who's, you may want to speak for yourself there.
Oh, not too much, just to make sure that it would work across both of those systems. There were a few issues that did have to be addressed, but
yeah, it
should work okay on either one. If it doesn't, we'll find a way to make it work. So.
Yeah, so we make regular updates to CDEMS, and we post those updates on our office website. So as you have questions, comments, want new features or modifications built in, we do our best to field those, and then we post those updates out there for download. Yep, and you'll check the version on the website. Okay.
Right, and as Adam said, the data itself is stored separately, so if we make an update to the application module or the reporting module, it doesn't affect your data. It's still as it was, so that's a good thing. You can replace the whole section without breaking anything for the most part.
We like to avoid breaking things. Yes, absolutely. And this is something we brought up in the first learning session last month, but it was worth reiterating. Thinking through an office flow for the data entry, and if at all possible, importing data into your system is always something good to think through. A lot of our partners maintain their registries in great part by importing data in rather than hand entry, but that's not always an option. But if you do have existing data somewhere, whether it's a lab company, a different registry, an electronic health record, whatever that might be. Spreadsheets, right, spreadsheets. If you do have data living somewhere that you'd like to migrate into CDEMS, we would really like to know that. Another question from Chuk. I don't quite understand the question. It was something about helping with the electronic data. If you could ask that, or that was the question. So yeah, we can learn more about exactly what you need. We do a lot of support over the web. We can connect to your computers at the clinic or the hospital or whatever type of primary care center you might be working at. So some of the issues and ideas that we'll uncover over these learning sessions, what we want to do is follow up with you all individually as needed to do some site-specific work. So if there are specific data needs that you have, again, we want to know about those and field those issues, field those questions.
And it doesn't have to work the same for everyone. This is a tool for you to use as it works best for you. So as like this says, office flow, you might want to have your own way of using it. So it doesn't have to be our way. You can create that on your own.
Mm-hmm. Yeah. So going forward, I think that please let us know if there are opportunities to save you, your providers, your staff time in doing hand entry of data. if those opportunities exist, we'd like to know about them. And if we could build some sort of a tool to import data and help you over time, we'd like to know about that too, and help save on time and energy into registry maintenance. So we have a user guide for CDEMS. It's very simple. It's very short. We wrote it. It's not complicated on purpose. There are 2 ways of entering data into CDEMS. This is on page 9 of the user guide, and I can post this guide with Gwen out on our listserv. Oh, by the way, I'm jumping around a bit, but we just recently set up a web-based forum or a listserv for all partners who want to be involved, so that in this PCDC collaborative, as there's need arises of sharing documents or presentations or posting things on a shared calendar or asking questions or whatever that might be, we have a sort of a social media sort of website specifically for our group here. And if you would like to join that, please let me know. The only thing that I would need is your email, and I can add you to that group. Some of you might already be members of that group, and if you're not, I'll simply apologize because I didn't know to add you yet, but I will be glad to do that. So what reminded me of that was the user guide for CDEMS. I'll post that on the web group also, so that we can access it in multiple locations. Most of our partners, in terms of if they have to do hand entry into CDEMS, tend to use the standard form, which is the larger image in the background that you see there. So that form is broken out into sections. You have a section for the visit information, a section for their health conditions, medications, labs and services that they're receiving, other special measures, and then notes, free text notes. So it's very simple, point and click, you know, and save. So if there are issues in data entry, we can look at that now. I've got a copy of CDEMS that I can, and I'll keep my eye on the time. I'll work through these slides fairly quickly, and then I will jump over to CDEMS, and we can work through each of these things in a more live sense so that you can see how they work in the registry. So we'll look at the data entry, and we'll look at data editing. Editing is on page 14 of the user guide. Everything that you enter into CDEMS can be edited. So if there was a mistake made along the way, that can be remedied, whether it's someone who might be missing some health conditions, or have some medications that need to be added or modified, or if vitals were incorrectly edited, regardless of whatever that might be. Regardless of what that might be, your data can be edited. So we'll take a look at that together. The utility tab, this is one of the strong suits of CDEMS. What we'll look at in particular is the setup wizard. So in terms of specifying what data are being collected in the registry, this is where you can do it. So if you want to have a diabetes registry that contains many more measures than would be, you know, the basic measures that everyone's tracking, you can set that up. If you want to scale it back to include only those essentials for tracking and reporting, you can scale it down. So all of these things are completely at your control, and we can show you how to do that. And reporting is very much point and click. For every report that's in the registry, you specify the time period that you want, select the report, and then just run it. CDEMS did not come with many reports in it in its original format. we've been adding reports to the registry over time based on what our partners have wanted out of the registry. So as you all identify new reports that you'd like, we'd be glad to build them in. Also, features that were not in the registry initially that Mary built in are reminder letters and call lists. There's also other flow sheets and stoplight letters that are available, and we'll take a look at those too. I'll keep my eye on the time. I have about 20 minutes. Creating new reports is a nice feature in the registry so that you don't have to rely on us to build reports. You can do those things also. For some of the more complicated reporting that might require multiple queries and a lot of coding, we can help with that. But for some of the basic reporting, you can build summary reports and patient level reports by yourselves. And it's supposed to be easy, and it is easy. So there should not be anything about CDEMS that is complicated, and if there are things that are complicated, we're failing at something, and we need to know about it so we can improve on it. This is a sample view of a reminder letter. So this is on page 22 of the user guide. So if you want to send, for example, or generate call lists or reminder letters for every patient that you see that has diabetes that needs an office visit, that's one of the basic things that you can do with the registry. Or if you want to generate reminder letters for every patient with diabetes who needs an HbA1c or who's had a last HbA1c above a certain threshold, you can do those sorts of things too. So the whole point behind CDEMS is that once you've collected the data one time, you can put it to multiple uses. And we want to make sure that you're comfortable, again, comfortable as possible, getting the most out of your data. So we have about 20 minutes now where we can look at the registry together, go through some of those basic features in a live demo. This is our contact information, and we're very glad to be working with you. So as you have questions, feel free to call or email or Skype. I should put my Skype name up here. It's just adam.baus. If that's a good way for us to connect, that's great too. I'll go ahead and get out of the presentation, and while I open up CDEMS, if there's questions about anything that we covered so far, feel free to type those into the chat or just go ahead and ask those questions as you have them. Okay, so this is the CDEMS. What's up? Oh, this is the CDEMS app, the application. So this is where you can print, preview, enter, edit data, and just view what's going on by patient. So we have a couple sample patients in our registry. One's diabetes patient, another is a newer sample patient. So there's 4 different note types that you can choose from if you want to see. So I selected the diabetes patient, and we have different ways of displaying data for that person. There's the progress note that you're probably familiar with already because you have some familiarity with CDEMS. There's also a flow sheet. We can take a look at that just in case you've never seen one. Some of our partners were honestly not great fans of the progress note. They thought the form was very busy, they didn't like all the check boxes, etc. And so they wanted to see the same data but in a different kind of display. They wanted a more traditional looking flow sheet. So Mary built this to suit those needs. In this form you can see whatever data has been entered for that patient displays on the form. And so the measures grow or shrink simply based on what's been entered. So for this person, you can see when they came in July of 2015 and in August of 2016. You can see the vitals, blood pressure, BMI, height, and weight on each of those days, and then the lab work that they had done for each of those visits, cholesterol and HbA1c. At the top, you've got their name, chart number, their doctor, gender, date of birth, age is calculated for you, and then their list of diagnoses and medications. So if we close that one, but view the progress note for that same person, what you'll see is the very same data, only displayed in a different way. So here's that same person. You've got their but in this case, their most recent data are displayed on the progress note. So whereas on the flow sheet we could see both visits that they came in, on this progress note you can see just the last one. The date they came in, again, weight, height, BMI, blood pressure. You can see they have type 2 diabetes. There's that beta blocker. There's the HbA1c and the cholesterol that we saw before. So again, same kind of information, but a different sort of display.
And that allows to flag the ones that are out of range with colors and so forth. So,
right.
So you can see that things are red if they're too high or too out of date or something like that.
Yeah, that's a good point, Mary. Thank you. So the progress note is intended as a flagging system. So if something is overdue, or if a value is outside of the guidelines that you'd hope for, you can set those boxes to be flagged. So it's a quick way of glancing at that sheet and seeing, okay, the last HbA1c value was kind of high. It's flagged in yellow. The last cholesterol was done last year. You know, it's well time to do that again. And there's also a second sheet of the progress note that is a graph form. So their weight, height, their weight and blood pressure are graphed, as well as labs are graphed over a 24-month period. And those you can also specify which graphs you want to have included in those reports. So the entry, we said that there were two styles of data entry. Again, there's the progress note. So I went to the entry tab, and then you have the add new data in the progress note or add new data in the standard form. Most folks do use the standard form. So the default is today's date. If the weight changed a little bit, let's say they lost a couple pounds, blood pressure, we can go ahead and save that. So we just made a new visit date. We recorded the weight. The height sticks from the last time, so you don't have to re-enter that. And we added a blood pressure. So we'll view that flow sheet again after we close this form, and we'll see that we'll have new data on that sheet. So we can go ahead and close that. And if we go back, view the same flow sheet as before for that same patient, you know, here's today's date, you know, November 15th, at least it is here, and here's the vitals that we entered for that date, and that's the only thing I entered, so that's the only thing that displays. If we, as far as the editing, if we saw that maybe I made a mistake, right, and I want to edit the blood pressure, it wasn't 130/80, I meant to type 130/90 instead. Okay, I can make that edit, close the form, and going back here, back to the flow sheet, you can see now it's 130/90 instead of 130/80. So the editing, everything, and I apologize for moving a little fast, and we don't have a whole lot of time this evening, it's going by quickly, but you can see there's the ability to edit every piece of information that you enter on that person, whether it's their contact information and demographics, visits, notes, health conditions, meds, labs, services, or measures. All of those things are editable. Likewise, if you need to make somebody inactive, under Edit Patient Information, there is an inactive date, so we could key in today's date, and a reason if we so choose. Maybe they moved, and we can save that. And you can see they're now no longer on our list, but they're not gone. They're on the inactive list. So I clicked the inactive radio button, and here's our diabetes patient. So the benefit of that is that you get to keep all the data, all the hard work that you put in, entering and collecting data on that person. It's all saved, but it just gets set aside for reporting. So if you go to run a summary report or a patient level report, that person who moved away won't be included. If you want to bring them back, say, happily they're back, we can just simply get rid of that inactive date, save the record, and our inactive list is now empty, and sure enough, they're back on our active list. So that's a good thing to know how to do, especially good for your data quality and the accuracy of your reports whenever you do run reports by patient or patient population. Let's see, we have about 10 minutes, just keeping my eyes on the time. The utility tab does have a lot of features in it. One thing that's very good to be aware of in the limited amount of time that we have tonight is the setup wizard. So I click that button, and again, CDEMS being a relational database, everything is tied to health conditions, okay? That's where everything in CDEMS is generated from. So if we look at type 2 diabetes, I selected that from this top left-hand box. It shows you, while all of these related boxes were empty, now they're populated. So it shows you every piece of data that's associated with type 2 diabetes. The importance of that is specifically with the progress note and the summary reports. So as you have measures that you want to make sure that you're collecting on your patients, this is the place to do it. So maybe you decide, in this example, maybe you decide tetanus vaccines, that's really not something we need for diabetes. I don't want it on the progress note. I don't need it in the reporting. You're trying to streamline your forms. You can select it and simply remove it. And now tetanus vaccine is gone. Likewise, maybe dental, it's important, but it's not something you're tracking right now. Go ahead and get rid of it. And you can pare these things down or ramp them up as you need. So as you select something from the existing or related box, you can put it back into the all possible box. And it's a nice way of just paring down or ramping up. Also, if you have some new measure, I'll just type in new measure for DM. As you have something new that's not already in the registry that you want to track, you can key that in, click enter, and it'll ask you, do you want to add the service, whatever you typed in. I added new measure DM. And we'll say, yeah, we'd like to add that. And that's what it'll be called, new measure DM. And now on our all possible services box, if we scroll down to the ends, there it is, new measure for diabetes, and we'll go ahead and add it. Do you want to add that service? Yep. And now it's there. So on the progress notes, you've gotten rid of two things you didn't need, and you've added something that wasn't there already that you do want. So the reporting is really the same. It works the same way. So it's not difficult to modify the registry. From our experience, the most difficult thing is having those discussions and deciding, making sure that you're tracking what it is that you want, making sure that your reports are giving you the data that you want, that you can share weekly or monthly at your provider meetings or medical staff meetings. But suffice it to say, the registry can be modified to suit your exact needs. As you have questions in doing this, we're glad to help you with it. We don't want to just throw a lot of information at you quickly and assume that it's going to make sense. That would be a bad assumption. So we'll rely on you to let us know what we can do to help you with this. If you're more self-paced, self-taught, that's great too. The user guide will walk you through doing each of these sorts of steps in the registry, but we do want to make certain that you know that we're available to help you as you need help. Cecil.
What about adding a new diagnosis or problem?
A new diagnosis. Sure. I'll call it Cecil Pollard.
I think there's a cure for that.
So we'll add the condition Cecil Pollard. Yep. And that's what it'll be called. So there you go. You're now a health condition, you know, and as we want to add things, so for if someone has come down with a case of Cecil Pollard and it's important to track their glucose, we can make sure we know about their glucose and eye exam information, right?
And some people have done things like, you know, preventive health, or if you have some initiative where you are tracking those things for, you know, a group of people, you could use this to do a certain group as a diagnosis almost.
Yeah, that would have been a better example,
Well,
Mary.
that's okay. I like Cecil Pollard.
That would have been a very good example. But like Mary was saying, sometimes rather than a specific health condition, you want to track maybe a risk factor. Or a group of patients.
Like
so
CDEMS intervention or something like that.
Right. So you can see we have adult preventative health measures for men, adult preventative health measures for women, and as you cue those into the patient's health profile, those will bring up their own sets of metrics. So Cecil, I apologize that I used your name. That probably wasn't the best thing to do. But yes, you can, as you have new health conditions that you want to add them, new DX. That would have been a better one, right? So we'll add new DX. And now that's there. So, but you can see the things that we added into the list of all possible diagnoses are now there. And new DX. So
yeah, don't feel like you have to learn the whole registry in one, you know, hour seminar. Just, you know,
no, not at all.
This is a big overview, and then we can come back to more specific pieces one at a time.
Yeah. This is a very, very fast overview of a lot of information. So thank you for bearing with us. Quickly, the reporting. It would probably be best if we, in the few minutes that we have, if we take a look at how to create a new report. It really works the same way as modifying the measures in the registry, just like we were doing. So right now we're looking at summary level reports. We can also look at patient level reports or reminder letters, right? But we'll look at summary reports, and we can use the create a report feature. So I'll click run, and it's set up just like our last screen was. So if we want to make a new report for type 2 diabetes, the first thing we do is you select the health condition you want to report on, type 2, and now you see that we got all of those measures that are associated with it. They all came up. Here's that new measure for diabetes that we added a few minutes ago. But you can have a very streamlined report. So if you want to know things like how many patients you have, how many don't have a visit, how many have come in, you'd like to see their blood pressure, how many have got a blood pressure, and how many have a blood pressure greater than or equal to 130/80, whatever you might happen to be specifying. Okay, so we'll save that report, and we'll call it, we'll just call it diabetes type 2 blood pressure, because that's all that's in it right now, really. So we've added that to our list of reports. So, right, there it is, it's highlighted. So we can run that report, which we'll do. So you can specify your start and end dates. Run it. and you can run it by all patients. You can run it by patient provider. We built other features in here that if there's some sort of demographic variable you want to run by or some other grouping, we've built those in, and we can add more. But here in our sample patient population, you see we have 2 patients with diabetes. Let me see if I can zoom in a little bit. Yeah. So we have 2 patients with diabetes, type 2 diabetes. One has come in for an office visit in the period that we're looking at, and one has not. And of the one that did, they've had a blood pressure taken, and that blood pressure was greater than the threshold that we had set. It was greater than 130 and greater than 80. So that's all that's on our summary report, because that's all we asked for. So that is one nice feature of the registry. And sometimes the summary reports have lots of things on them, and they're all important, and that's good. But sometimes for more specific discussions, it could be helpful if the report is tailored to exactly what it is that you want to focus on, which also has its benefits.
And you can take the sample data that's included with CDEMS, like Adam's doing now, and just kind of play with it and build things, if you can find time to do that without worrying about messing up your real copy.
Yeah.
So that's a good thing to do to just get started.
Yeah. And we had talked about outputting de-identified data. So again, in the reporting tool, utility tab, there's a button, output de-identified data. So we click that, and we click on the create de-identified data button, and it'll ask us what we'd like to name it. So it'll time and date stamp the data file. So you can see it's November 15th, 2016 for us at 5:59 p.m. We'll click OK, and new database created.
Now that outputs it as another Access database. Now if you needed each table in Excel or something, or as text to import into another system, that's possible too, but it would take a little more technical work. Then there's not really a button for that.
Yeah, and here's the data file that we created, so we can open that up. And you can see that in the registry you have those same tables, table demo, but rather than the patient's names being included or their actual chart numbers, those have been modified to be more of an auto ID. So last name, first name, middle name, all of that contact information has been taken out and replaced with de-identified data. And that data file could be shared with other partners. So it is already a minute past the time that we had allotted. There's a question here I want to take a... So what about gender? Is there a way to click male mammogram or perhaps female PSA? Okay, so that's a question from Palau about the adult preventative health measures. It sounds like if you're not seeing certain things like mammography or pap smear coming up for females, it sounds like we could take a look at your data file set up with you, and it wouldn't be hard to fix that, but there would be just a little setup that would need to be done with how your measures are defined in the registry, and we could do that together pretty easily over the web and make sure that the reports to correspond with those measures are there too. I'm going to look for other questions in the chat that I might have missed. Okay, that's it so far. Are there other... I know that was a lot of information in a little bit of time, and so I apologize for that, but whatever we can do going forward to help you, and regardless of whether you've been on this webinar live or you're watching it at your leisure later, leisure later. We'd be glad to help you use CDEMS as best as possible. So, please let us know. Our contact information is here.
Call Adam if you have any problems.
and I'll tell Mary that I need help. But we'd love to hear from you, and we appreciate having the chance to work with you. So I'll pause there, but thank you. You guys have anything?
Nope, thanks for attending.
It's very quiet here.
No follow-up questions?
I'm looking. I'm going to make sure that there's no other questions.
What about the de-identified exporting data? Did you satisfy that one?
Oh, so it's, let's see, deceased NCD, deceased patients still showing up. We would need to make sure that they've been marked inactive. We can look at that together. What can we do to fix that error? Oh.
Hello?
Hello?
You are, say thank you. Right. Thank you very much. Thank you. So they don't get so much out.
Thank you.
Thank you.
Thank you.
Bye-bye.
Thanks to all of you.
Can you wait for a while? We are not finishing yet.
There's a question from Palau.
Yes.
Go ahead, Susan.
Before we were able to deactivate those who are deceased, but right now we're having some difficulties, so we don't know if it's programming or something else.
Okay. Could we schedule a time and look at that with you? We could. We have a remote support software that would allow us to take a look at that issue with you. That might be the easiest thing. I doubt it'll take long to fix.
Okay, so I think we will schedule another sessions with you in regards to that questions, and then the other questions that we have is to create our own reporting. Because every time we generate report is always the same, but we want to, retune that report. Is that something that we can work on later?
Absolutely. That sounds great.
Maybe you could send us any questions, any future topics you'd like to talk about. The list of things.
Can you repeat that? We did not hear that clearly.
So I was saying, if you have any things you'd like to have covered in future webinars, if you could send those to us.
One last question where we have CDEMS. Now our question is, when are you going to? Well, we want to move now to.
And then over here, I'll give you the date. For this one, we don't have an internet, so okay. No.
So you must make sure you order the extras.
What extra?
I mean the extras. Surfer or whatever.
Analysis, you bring the one new text.
So we will move to see the right?
Yeah,
Yes, we
that's
are.
only one program. By and by, we'll move everybody's program to CDEMS. Because this is a very good.
For 2017.
Yeah.
Yeah.
You know what? Now I have a very headache. When you want to go to get a PET test, you have to look for every computer, ask and beg the doctor, how much can I get or something? And then there are all these things. I never recall. I never have. But now I make a one book for logbook for new doctor.
Yes, you I saw you.
Yeah, because I make it myself. I go and find this logbook. And then
Can you send us a copy of your PowerPoint presentation?
Absolutely. We will do that.
This coordinator do. I don't know how
Okay,
many years.
we'll email you and find another time so Palau can address those two issues.
Okay, that sounds great. All right, well, thank you all.
Thank you.
Thank you.
Take good care.
Well, thank you so much.
Bye-bye.
Bye.
Bye-bye.
You can get the practice. Number of practice can this previous program. We gotta go and look for one program.
Copy to mo na.
Extract for one program.
So, sa spreadsheet to mo na raw. Session mo.
Even the data is correct.